Hey everyone, this is Reggie from Restore Plus Physical Therapy. I'm just finishing up some of my documentation, some of the notes that I'm doing for the patients, and I came across this one of my patients. I think I had her initially two weeks ago, and I was going through her documentation. Just it reminded me about something, and I want to share this with everyone. Stories like hers, I hear it way too often, and it saddens me whenever I hear that. This is what happened. She had knee replacement, so she had knee surgery right before COVID got really bad here in New York. And after the surgery, she was not able to get physical therapy as much because here in New York, we got shut down. Now, when things got better, she went back to the physical therapy, right? Now, the clinic that she went to, I don't like saying that they did the wrong thing, but the treatment that she got was not the best suited was not the best program for her type of surgery. And she ended up having the knee being worse. And when she went back to see the orthopedic surgeon, he wasn't happy with the lack of progress. So she was referred to our clinic. And here's the thing, I hear this a lot, from patients, and I love my profession. I've been doing this for like 20 somewhat years. I love my profession. I'm very proud of it, and I love what I do every day. And the whole staff, we share the same passion to our craft. And it saddens me to hear stories like this, because our profession, we're in a unique position to, as physical therapists, to transform people's lives. Every day, we get the chance to make people's lives better, for them to be able to do what they love to do. But on the other hand, if not done properly, we also, as physical therapists, can make people suffer. We can make their lives hard, needlessly, which is not what, anybody wants. And it's not what definitely the patient wants. And that's not the reason why definitely not the reason why they had the surgery. So it just, I just want to get this, share this, with you, because it happens a lot. And for those patients, for us, we've been trusted by doctors, people, our patients in the community, to be able to help them get through situations like that, to improve, to get back to doing what they love to do. But even if we are not able to help patients get back to achieving what they want, they trust us enough that they would listen to our suggestion when we guide them to what the next step is. Because we have to be realistic. Not everybody we can help, but the ones who we cannot help, at least we can guide them to what's the next step that they have a chance to to improve, or to have a better life, and to be able to do what they always have wanted to do.